Hello, and welcome back. I'm Dr. Jennifer High, and if you or someone you love is over the age of 60, I need you to stop whatever you're doing right now and listen closely, because what I'm about to share with you could genuinely save a life. Pancreatic cancer has earned a terrifying nickname in the medical community, the silent killer. And there's a reason for that. It hides. It whispers instead of screams. By the time most people get diagnosed, the disease has already had months, sometimes years, to take root. But here's what most doctors won't tell you in a 10-minute appointment. Your body does send out warning signals. They're just easy to miss, easy to brush off as just getting older, or probably something I ate. Today, I'm going to walk you through 8 symptoms that seniors and their caregivers should never, ever ignore. Some of these might surprise you. One of them has nothing to do with your stomach at all. Stay with me until the end, because symptom number 6 is the one that even experienced doctors sometimes catch too late. Let's start with the one most people have heard of but rarely understand: jaundice. Picture this. Margaret, a 68-year-old retired schoolteacher, noticed her eyes looked a little yellow one morning while brushing her teeth. She assumed it was just bad lighting in her bathroom. A week later, her skin had a strange golden tint. Her urine had turned the color of strong tea, and her stools had gone pale, almost clay-colored. That combination is not a coincidence. It happens when a tumor in the head of the pancreas blocks the bile duct, causing bilirubin to build up in the bloodstream. If you notice yellowing of the skin or the whites of the eyes, especially paired with dark urine and pale stools, that is your body sounding an alarm bell. Don't wait it out. Get it checked immediately. The second symptom is one that seniors dismiss constantly: unexplained weight loss. I'm not talking about losing 5 pounds because you started walking more. I'm talking about dropping 10, 15, even 20 pounds without changing your diet or activity level at all. Think of it like this. Imagine your car suddenly starts using twice as much gas, but you haven't driven any farther. Something is consuming your fuel reserves that shouldn't be. Pancreatic tumors release certain substances that increase your body's metabolism and break down fat and muscle, even while you're eating normally. If your clothes are suddenly loose and you can't explain why, that's not a flattering mystery. It's a red flag. Third, let's talk about abdominal pain that doesn't behave like ordinary indigestion. This pain often sits in the upper abdomen and has a sneaky habit of radiating straight through to the back. One of my patients described it as feeling like a dull ache that wraps around my middle like a belt that's 2 sizes too tight. Many seniors mistake this for arthritis, a pulled muscle, or even heartburn. But here's the distinguishing clue. This pain often gets worse after eating and may ease up when leaning forward. If you've been popping antacids for weeks with zero improvement, that persistent gnawing ache deserves real medical attention, not another bottle of Tums. Fourth, and this one catches people completely off guard: sudden onset diabetes or a dramatic, unexplained worsening of blood sugar control. Imagine a man named Robert, 72 years old, who had never had blood sugar issues in his life. Out of nowhere, at a routine checkup, his doctor finds his glucose levels through the roof. No family history, no major weight gain, nothing that fits the typical type 2 diabetes story. Researchers have found that new onset diabetes in older adults, especially when it appears suddenly and without obvious cause, can sometimes be one of the earliest detectable signs that a pancreatic tumor is interfering with insulin production. If you're a senior who suddenly develops diabetes seemingly out of thin air, please ask your doctor whether further imaging is warranted. Fifth on our list is a loss of appetite combined with what doctors call early satiety, meaning you feel completely full after eating just a few bites. Think about someone who used to enjoy a full plate at Sunday dinner and now can barely finish a quarter of it, feeling stuffed and uncomfortable almost immediately. This happens because a tumor can press against the stomach or disrupt normal digestive signals. It's easy to write this off as just not as hungry as I used to be, but a persistent, unexplained drop in appetite, especially paired with that early fullness. Is your digestive system trying to tell you something isn't right? Now we arrive at symptom number 6. The one I promised would surprise you: unexplained blood clots, particularly deep vein thrombosis in the legs, or even clots traveling to the lungs. This is one of the most overlooked warning signs in all of oncology. Picture a woman in her late 60s who suddenly develops a swollen, painful, warm calf with no injury, no long flight, no obvious cause. Most people, and even some doctors, treat this as an isolated vein problem and move on. But certain cancers, pancreatic cancer included, can cause the blood to become hypercoagulable, meaning it clots far more easily than normal. This phenomenon even has a name in medical textbooks, Trousseau's syndrome. If a senior experiences a sudden, unexplained blood clot with no clear triggering event, that should prompt a broader investigation, not just blood thinners and a pat on the back. Seventh, let's discuss digestive changes that go beyond the occasional upset stomach, specifically pale, greasy, foul-smelling stools that float instead of sink, a condition called steatorrhea. This happens when the pancreas can't produce enough digestive enzymes to break down fat properly, often because a tumor is physically blocking the pancreatic duct. One way to think about it, your pancreas is like a factory producing the chemical tools your gut needs to process food. When production shuts down, undigested fat passes straight through your system, leaving behind stools that look oily, smell unusually strong, and are difficult to flush. If this becomes a recurring pattern rather than a one-time thing, it's worth mentioning to your doctor in detail, not glossing over out of embarrassment. And finally, symptom number 8, persistent, unexplained fatigue and weakness that doesn't improve with rest. This is the symptom most easily dismissed because, let's be honest, who doesn't feel a little more tired as the years go by? But this isn't the "I need an afternoon nap" kind of tired. This is bone-deep exhaustion that doesn't lift no matter how much sleep you get, the kind that makes climbing a single flight of stairs feel like running a marathon. When combined with any of the other 7 symptoms we've discussed today, this profound fatigue often signals that the body is fighting something significant beneath the surface. So let's recap quickly, because I want these 8 symptoms burned into your memory. Jaundice with yellowing skin and eyes, unexplained and significant weight loss, upper abdominal pain that radiates to the back, sudden onset diabetes with no clear cause, loss of appetite paired with feeling full too quickly, unexplained blood clots, pale and greasy stools, and persistent fatigue that doesn't improve with rest. Now, before I close out today's discussion, I want to be completely transparent with you because your trust matters to me more than anything. I am sharing this information to educate and empower you, not to diagnose anyone watching this video. Having one or even a few of these symptoms does not automatically mean pancreatic cancer. Many of these signs overlap with far more common and far less serious conditions, from gallstones to ulcers to simple aging. But that is exactly why awareness matters so much. Pancreatic cancer survival rates improve dramatically with early detection, and the single biggest obstacle to early detection is people, wonderful, strong, independent seniors, convincing themselves that what they're feeling isn't a big deal. I have seen too many patients delay a visit to the doctor because they didn't want to make a fuss or waste anyone's time. Please, I am asking you directly, do not be that person. Your life, or the life of the senior you love, is never a waste of anyone's time. If you've made it this far, I want you to do 3 things right now. First, think honestly about whether you or an aging parent, grandparent, or neighbor has experienced any combination of these 8 symptoms in recent months. Second, if the answer is yes, please schedule an appointment with a physician this week, not next month, not when things calm down, but this week. Early imaging and blood work can rule things out quickly, and peace of mind is worth far more than the inconvenience of an appointment. Third, share this video with someone in your life who needs to hear it. You never know whose life you might change simply by hitting that share button. Pancreatic cancer earned its silent reputation because it doesn't announce itself with sirens and flashing lights. It speaks in subtle changes. A little more fatigue here, a little less appetite there, a strange new ache that doesn't quite fit the usual pattern. Your job, and mine, is to stop ignoring the whispers before they have the chance to become something far louder and far harder to treat. I'm Dr. Jennifer High, and I am deeply grateful you spent this time with me today. Knowledge like this is one of the most powerful tools we have, and now it belongs to you. Take care of your body, advocate fiercely for your health, and never apologize for asking your doctor one more question. If you found this information valuable, please like this video, subscribe for more health awareness content, and leave a comment below letting me know which symptom surprised you the most. I read every single one. Until next time, stay informed, stay proactive, and most importantly, stay well. I'll see you in the next video.